I'm Dr. Sridhar. Welcome to my channel. I hope you're enjoying the videos that have been shared so far. I have a request. Please do subscribe to the channel, as your subscribing motivates me. And please do like and comment on the videos as possible. So we have an MCQ in this case about the ventilation-perfusion ratio. We have to indicate if the VQ ratio increases or decreases in each of the following. So a large PDA with left to right shunt, congenital pneumonia, meconium aspiration, bronchiolitis, collapse, which is atelectasis of a lung segment. So when we say ventilation perfusion ratio increases, that means the ventilation is more, perfusion is less. And when we say the ventilation perfusion ratio reduces, that means the ventilation is lower than it should be. So the perfusion is higher and the ratio becomes lower. So which situations cause increased ventilation and which situations cause reduced ventilation? So in a large PDA with the left to right shunt, so usually we have lung flooding. So we have left to right shunt and we have more blood coming into the right side. The lung is at risk of pulmonary edema, and when the pulmonary edema happens, there is a reduced ventilation, and the perfusion is actually increasing, which may not compromise. So there is a reduced ventilation in these situations, so the VQ ratio will drop. In congenital pneumonia as well, we have reduced ventilation. In meconium aspiration, we have a complex picture. You may have ball valve distension, which affects the circulation as well in some areas, and there may be segmental atelectasis, which reduces the ventilation. In bronchiolitis, we have a combined picture as well, but mostly it's reduced ventilation. Again, segmental atelectasis causes a low ventilation in that portion. So the collapse of the lung leads to low ventilation. So most of these situations lead to reduced ventilation, but the perfusion may be affected as well. And remember that when a baby is having significant respiratory distress, by the shock-like situation, the perfusion to the entire body, including the lung, is going to drop. So the VQ ratio, when both are affected, may be maintained, but when the ventilation is mainly affected, the VQ ratio will reduce. And where the perfusion is maintained but the ventilation drops, the VQ ratio will be low. So I will share the link to the video which discusses ventilation perfusion, and you can review that as well. I hope you like this and you find the information useful. Please do like the video. Please do share it with your colleagues as well. And please do subscribe if you have not already done so.